Good morning. Good morning to all our audience. Today we are going to finish with a presentation of Dr. Frauke Kreuter titled Global COVID-19 Symptom Survey, a Facebook Partnership. I will read a brief summary of Dr. Kreuter. Frauke Kreuter is Director of the Joint Program in Survey Methodology at the University of Maryland, USA, Professor of Statistics and Methodology at the University of Mannheim, and Head of Statistical Methods Research Department at the Institute for Employment Research in Nuremberg, Germany. She received her master in sociology from the University of Mannheim, Germany, and her PhD in survey methodology from the University of Constance. Before joining the University of Maryland, she held a postdoc at the UCLA Statistics Department. Her research focuses on sampling and measurement errors in complex surveys. In her work on GPSM, she maintains strong ties to the federal statistical system and served in advisory roles for the National Center for Educational Statistics and the Bureau of Labor Statistics. In addition to the academic work, Dr. Kreuter is the founder of the International Problem Survey of Data Science developed in response to the increasing demand from researchers and practitioners for the appropriate methods and right tools to face a changing data environment. Co-founder of Coleridge Initiative, whose goal is to accelerate data-driven research and policy around human beings and their interactions. She's also co-founder of the German language podcast, Dig Deep. Dr. Kreuter, thank you very much once again for being with us. The floor is yours.
Thank you very much, Hugo. It's a pleasure to join this group here and talk to you guys. I would have liked to travel to Mexico, but this is second best, and I do hope that those in the audience and those organizing this conference don't hesitate to reach out afterwards to be in touch either about this project or about any possible future collaboration. I think I can fault myself for that too. I think in Europe or in Northern America are very Europe and Northern America focused, and to the extent that you can break those barriers a bit and help us to be more global in our thinking and understanding of methodology, then I welcome that. On this note, I do gladly take the opportunity to share with you some work that we have been doing over the last 6 months. And while this is a conference sort of in the spirit of bringing in new technology, new data, and new methodology into statistical systems and work of official statistical agencies, on this one here, we go back to surveys, and because in certain situations, they're still a good tool. So I'll talk to you about that, and I'll talk to you a little bit about that crosswalk that Hugo mentioned at the end. Even when you do a survey project like the one I described here, there are a lot of data science skills still needed, and we noticed that our students had to ramp up quickly to meet the demands. Speaking of the students and other faculty members involved, a project on a global scale cannot be done alone. So I do want to acknowledge all of my teammates, and these aren't even including the people at Facebook yet, but those at various universities who have contributed to either the questionnaire or the entire production pipeline. So why provide a syndronic surveillance survey and build this tool? We all, or many of us, have early in the pandemic probably used the websites from Johns Hopkins University, watching the numbers of COVID cases rise across the world. And those were important figures to signal the spread of the disease. However, it was interesting to be pulled into a conversation that a lot of public health researchers brought up to Facebook, saying that what would really be helpful to have a warning system that's a little faster than the actual data from testing or even death, right? Ideally, you would want to know where is the next wave, where is the next hotspot, and be able to act in those places. And there were several different researchers that approached Facebook to use the big platform that so many people in the US, but also globally, use to issue a survey where one can ask on a daily basis about symptoms people experience, and with that get a good tracker over time on possible spread of the disease. So that was the starting point. There were a lot of different organizations, including the World Health Organization, that were interested in this project. We tried to create a questionnaire that sort of consolidated all the wishes that people had, and this is the result of it that I'm presenting here. So I'll give you a quick update of the project structure, and for this audience, obviously more detail on the survey instrument and the actual weights we used. And then some early insights, and I hope that in the discussion afterwards, we can have a reflection on these insights to see what this group thinks about the validity of the data collected with this instrument. I'll also share some reflection on data collection challenges we faced, and as I mentioned, skills necessary in the area of survey and data science. If you're interested in accessing the data, I'll provide those links. So let me start with the project structure. The idea was to capture people's attention when they log into Facebook, usually on their mobile devices, but also on the web, and to show them an invitation to this data collection at the very beginning of their newsfeed. So this is not a recruitment via an advertisement as you scroll down your newsfeed. It is really right there in your face when you open the Facebook app or enter the website to participate in the survey. I guess we could try the Zoom hand raising feature among the participants and see if any one of you were sampled. This has been in place for a while, and chances are that you have seen the survey invitation. Once people agree to participate in the survey, they get pulled over to a website on the university campus. For the US survey, this would be Carnegie Mellon University. For the global symptom survey, this would be us at the University of Maryland. And the reason we did this is we wanted to make sure that there is no possibility for any compromise of privacy on the answers provided in the survey to any data available on the Facebook platform. So users are sent to the survey hosted on our online survey platforms, in this case Qualtrics, and Facebook never receives the responses from the individuals. All Facebook sees in the end are the aggregated data results that are shared publicly anyway. However, what we do get back from Facebook weights to correct for non-response and any problems with sampling coverage. And those weights are calculated using internal Facebook data. They're created in a way that they cannot be reconstructed to identify the variables. More on that later. And then using these information that come in daily, we create aggregated statistics in the US on a county level. People are asked about their zip code. And in all other countries outside the US, the data is collected and provided at the region 1 level. So states would be a region 1 in most countries. Let's take a closer look at the survey instrument itself. The instrument is available in more than 50 languages. It helps to work with a big company like Facebook, who has armies of translators available to accomplish such a translation task. And we did, not in the first set of production, but afterwards, a back translation to look at the quality of the survey translation, and that was refreshingly good. We had some little tidbits here and there in the French translation, but overall, people seem to nicely have captured what we are after. The survey instrument has 5 sections. It has a long section on consent, almost too long from a survey methodology perspective, because that's the spot where people break off. If you have to click, you want to take the survey, You don't want to click through 5 pages of consent screens, right? Then there is a first segment on health symptoms, a segment on contact behavior, social distancing, interaction with others. There's a segment on mental health issues and economic insecurity, and then some demographic characteristics that we capture as well. The questionnaire has evolved over the course of the data collection a little bit. We're trying to adapt to needs and increasing knowledge about the virus. So, for example, the symptoms that we ask for have changed over time as we learn what symptoms might be predictive and different than the regular influenza. The US survey instrument is also translated in several languages and has by now very similar questions throughout. Initially, we started out with slightly different substantive goals and therefore had for the first few waves a different questionnaire. There are over 25 million responses globally so far, probably even more. Last time I checked was in October, and over 15 million completed in the US. And remember, data come in daily. We release them with sliding averages when we do the graphs. We don't release data like when the numbers have to accumulate it enough. So not for all. You see here on the map some countries for which no data is available, and that's probably because there weren't enough responses in those countries. In general, the survey is available, and reports get feedback for all countries where Facebook is legally allowed to operate. So how do we adjust for any sampling bias? We do report back to Facebook an ID variable that indicates which person answered the survey, not their actual answers, just the fact that they answered or didn't. And with that information, Facebook calculates analytic weights that correct for the random sampling that takes place on the sampling platform, and non-response that they know because they have the sampling frame, so they know who participated and who didn't, and are able to create non-response adjustments for those. This happens also daily. There's an automated pipeline that creates these, so the weights are created every day anew based on the sampling and the respective responses. In addition, in order to adjust for any coverage error, there's a post-stratification using basic demographics that are available for all of the countries. And that is used using the information that Facebook has on respondents with all the possible errors that might be in there, right? So, and this is something that we should be discussing later on. This is by no means a population that is flawless, right? This sampling frame has, by definition, not everyone in it. We know that there's no country in this world probably that has everybody in the country on Facebook. However, if you remember what the goal of this survey is, it's to see daily changes in outbreak behavior or outbreak movement in each of the countries. And our assumption is that the underlying population is not changing from day to day or from week to week, right? So the trend over time and the changes over time should be pretty reliable, even if the point estimates might not exactly reflect point estimates we would get from a different population. Also, it is important to note that it's probably, at least with respect to the symptoms, hard to imagine strong correlations between being on Facebook and your probability to catch COVID. And that might be a little different for some of the other measures on social distancing or mask wearing, but even here I would assume maybe we could see differences in attitudinal variables, but I doubt that we see big differences in behaviors. So let's look at some of the early results from this survey. On the US side, CMU Dayfall Research Center has developed short-term hospitalization forecasts in the US and worked closely with the Center for Disease Control in the US to see how well their forecast matches the actual reports later on in the hospitals. The symptom survey showed notable correlations with confirmed case numbers. the correlations were done on a geographic level. And you see here on the right side, the confirmed cases that are available from public health authorities, and on the lower graph, the symptom surveys for metropolitan areas, Austin, Dallas, Pittsburgh, and San Antonio. We have subsequently for the US gotten very many additional ways or data to confirm the cases. Here you see stretches of time between June and July for the number of daily new confirmed cases, and as they're reported from the health authority on the right, and those from the Facebook symptom survey, which matches nicely. And actually, now that I look at this graph, we probably should have done the right picture a week earlier, since we assume that people develop these symptoms and it takes a few days for them to get tested. It's also interesting to see that there's a high correlation between the new daily case rate from officials and the COVID-like illnesses predicted by the survey. The correlation is particularly strong in hard-hit areas, and that was reassuring because that was the purpose. I personally have to admit I'm more interested in some of the behavioral aspects, probably because of my social science rather than health background. And we have, a number of institutions that have worked with the non-aggregated public use data for at least one of the surveys. And some of those organizations, including IHME in Washington State, they look at mask using behavior across the world and have created several reports on that you can find on their website. We also have some more detailed analysis and interactive map on the Social Data Science Center at the University of Maryland that allows you to see the development of mask wearing over time. Here, of course, the question is sort of burning too: how valid are these data? And we have had the fortunate, or a good coincidence here that a reporter from the Washington Post got interested in these data and wrote a little piece published last month on his assessment of the Facebook data. And you can see in this graph that he created the relationship between the percentage of people who know someone with COVID-19 symptoms, that's one of the questions in the survey, and the percentage of people wearing masks in the public almost all of the time. So this is entirely survey data, internal availability, if you will. But it does show nicely that these two variables that, in essence belong to each other, hard-hit areas where mask wearing might make more sense being reported that way. Even more fun for me was to see the results from a Dutch psychologist who was interested in getting a Bayesian estimate on the mask wearing in the Netherlands, and he picked a shopping mall and observed in person the number of people with masks in that shopping mall, and did this over the course of a day, updating his estimates as he increased the number of observations. So you see here about 500 or 430 observations that he took, and whether they were masked or not, and arrived at a point estimate of about 41%. What was interesting is that he contacted us later and was wondering, what our percentage is, or our estimate for the Netherlands. And it turned out that, previously we had about 14% mask wearers in our survey, but for the time frame that he actually looked at when the requirement to wear masks kicked into place, we immediately saw that shift in our survey data and had the same point estimate of 41%. So this is Europe and the US, but I thought you guys might be interested in looking at something different, and I failed to point that out. Here and on the right side on slide 16, you already see, the Mexico for the weeks between, what is this, week 17 to week 40. So this calendar week, right? So April 26th to, April 20th to October 4th. And I was impressed, to see what high rates of mask wearing are reported for Mexico. And as I said, I can't wait to hear from you guys if that seems about right. And Mexico being a very big country, at least compared to countries I come from, I would imagine, and that's what we see in the data, that there is variation by region. And so on this graph here, you see, again, for the different weeks, the variation in the different countries. And I'll let you take this in here for a moment. My hunch is that the regions for which we lack data in later weeks must be less populated regions. And so it is easier for us to miss or not get the crucial threshold of respondents, or those smaller districts having a higher likelihood of not being sampled into the survey itself. So, overall, I feel like this looks for me from the outside pretty good for Mexico, in the sense that many regions have high mask wearing rates, which from all I learned about the virus is sort of your way to get through this in a reasonably good way. Now, the mask wearing only helps with not getting sick or not making others sick. It does not help and protect against mental health problems. And so we are working closely with mental health agencies, and included for that reason the questions on mental health on the survey as well. And we see, at least here in Germany, now that the second wave hit, that concerns about mask wearing are much higher than they were in the past, and that sorry, not concerns about mask wearing, concerns about COVID, and like the negative mental health effects are increasing, and people are very worried that the combination of winter and being locked in houses is not doing people any good. So if this sparks your interest, I would be delighted to see you access the data. The aggregated data, you see the links on the left, are available for anyone for further analyses. The disaggregated data are available also. There's a data use agreement needed. And if you write a short page with the interest of your analysis to the Data for Good address at Facebook, then that will be approved, and then templates for the data use agreement will be sent to you. There are other data with which I would call more the new type of data that are available at Facebook as well, and other platforms, of course. Also, Google has used their mobility data to create mobility index. Facebook used their Facebook platform data so the regular usage of the Facebook platform to create a social connectedness index, and see if this helps increase predictions. They also shared with the public data on predicting movement ranges and things of that nature. So that has been pretty extensive what's available there, and I encourage you to check that out. Now, I want to take the last few minutes of this presentation to point to a couple of data challenges that we found here. What we did notice is that you cannot do this alone. Like, taking survey data in on such a scale daily is just a lot of data pipelining work. The survey platform, the website platforms have, as we learned, suffered a bit from the strong load or the heavy load with the various translations needed. And I'm still worried that some delay is creating people to drop off the survey when they attempt to take it. It is also, of course, always difficult if you race against such a disease here and trying to get this started as quickly as possible. In hindsight, I probably would have changed a little bit the way we think of sharing the data to speed up the process and reduce the need for data use agreements. But the biggest piece was finding partners that help with the pipeline, so that APIs, automatic data exchange protocols can be created. And for that reason, I thought it's a good moment to share with you again the 2015 graph that we had put in the APOR task force report on big data. That, you know, data science, and this clearly being a data science project, really is a team sport. You know, we needed the domain experts that helped us correctly identify the really needed questions on such a limited amount of questionnaire space. We needed computer scientists that helped us set up the map, the automated data aggregation so that daily updates can be moved forward. And then, of course, a series of survey methodology experts that could help with the questionnaire and various statistics. But what's interesting for me to see here is that if we think of the new world of data that the National Statistical Institute think about, you know, in the past, we always had this situation, either experiments or surveys being sort of the main source of data we are using, well-designed, crafted, we knew what we want to do with it. And increasingly, National Statistical Institutes are interested on seeing what organic data can be used. We saw in the previous talk, photographs being used to inform social science research or decisions of sorts. And the same has been true for a while, right? Transactional data, social media platform data, administrative data as additional sources for social science research and National Statistical Institute needs. What this project had showed me, though, is that there are many situations in real life where the administrative data, in this case, the notification for an infection or the reports from the hospitals, you know, are fine, but they don't give a clear enough picture, or maybe not at the time that we needed. And it turned out that this combination of survey data augmenting the other resources was a good thing. So, you know, encouraging all the survey methodologists to still keep that muscle and remember that they are very much needed also in this new and changing data world. If you think of broadening data science skills, so when I see what was needed to create this project here, clearly it all starts with having the right research question, and that narrowed down very specifically, because only then can you make the right decisions on how to collect the data and how to report it. But, you know, in addition to that, you need a good understanding of the data generating process. In our case here, you know, the way people log into Facebook, the way the platform is used, the way people answer survey questions. And then what we lacked as survey methodologists and had to borrow as skills and learn from them, from the computer scientists, was sort of how to store and curate data that come in so fast at such high quantity. And, you know, our team is way too small to do all of the analyses. So this is, again, my shout out for you guys. If this is of interest, to use the data, produce the results, share with us the output that you generate. And hopefully this will be a useful resource to help deal with this global pandemic. If you're interested in acquiring further skills, we worked over the last few years not only in building the Social Data Science Center that I mentioned earlier at the University of Maryland, but also to build a series of training programs that can be accessed online. Now everyone is online, but we actually have been building this program for the last 5 years. So there are about 25 courses in survey methodology that run either 4 or 8 weeks that people can take even if they're not enrolled at the University of Maryland or part of any program. So if that is of interest, there's a website link here that will guide you further, or you can just contact me. And for now, I say thank you and look forward to your questions. Hugo, at least I can't hear you. I'm not sure if others can.
Yeah, thank you very much, Dr. Kreuter, for your presentation. I would like to start this discussion with some questions and remind the audience to write your own questions in the chat. There's no doubt that we are facing new and unknown conditions due to COVID-19 outbreak. Health and economy circumstances around the world have been modified. That is why it's necessary to address these issues with a new approach and new methodologies. In this case, we have a multidisciplinary project that takes advantage of social networks and data science in order to generate information on the scope of the problem and propose solutions both on the medical field and on the public policy design. You highlighted that this work has been multidisciplinary and has had big challenges. There is much to learn about it, how to coordinate and cooperate, minimizing cost. My first question is, last week we heard a work about consumer behavior in France with information in their credit card. They learned about the mobility implications for the spread of COVID-19 and the effectiveness of public policy. Do you have some hints about mobility with the information you have collected?
So what we collected not because, well, no, what we collected not because we have stayed away from asking people about their locations, and we turned, I mean, there's like these web survey instruments, right? Qualtrics, they have automated ways of capturing latitude and longitude where people take a survey. We are not using that data. You know, we didn't want to touch that. We said we want to work on a higher aggregate level with respect to the areas that people sample, and we rely on self-reports in this case. Now, this said, Facebook has done that, right? The other aggregated data that I showed, if you go to the Data for Good platform that Facebook created, you see other products that they created from the basically mobility signals that they get from when people use the website. So a similar idea, I guess, to the transaction data, that you take the secondary information to a transaction and turn that into a piece of information. I do want to say, though, that from an ethical point of view, it's sort of interesting to watch what's happening there, because if you think of you know, data privacy discussions that people want to, you know, they want to be informed about the use, and they're fine to provide the data. When I have a credit card transaction, I'm not planning to tell anyone about my mobility, right? And the fact that we are using it entirely out of context is sort of an interesting ethical challenge that in difficult times like these, you know, we might think of needing to, you know, tilt the trade-off in that direction. But yeah, I think we shouldn't overlook that tension.
Excellent. Thank you very much, Dr. Kreuter. I would like to know, according to your experience, what are the main challenges to deal with information that comes from social networks? What are the risks and the benefits for society? And in addition, how can this private information be used, for example, in statistics institutions like INEGI, the Mexican Statistics Bureau office?
So in general, I think social network data are super valuable and should be used because I do think that, you know, even if people just report about their own network, there's important additional information, and if you can observe them passively, even better. I think it is helpful for any statistician to think of networks as a unit of analysis, whether this is transportation networks or people networks or what have you. And unfortunately, I think many of our traditional statistics education doesn't include network data and network analysis, but that's certainly something that is important going forward.
Excellent. Yeah, we have questions about our audience, and I remind the audience to write your own questions as a chat. The first question, well, we'll have this. Let me see. Oh, from your perspective, how strong is the willingness of governments to take advantage of data science to steer their policy decisions? What is the profile of the governments that are more oriented to base their choices on data science?
Hugo, I'm not entirely sure if I heard everything that you said. There was a disconnect here for a second. Can you repeat that question?
Of course. From your perspective, how strong is the willingness of governments to take advantage of data science to steer their policy decisions? What is the profile of the governments that are more oriented to base their choices on data science?
I haven't made a survey of governments on their willingness to use data science, but from what I observe is that I mean, if you look what the UN does, or the OECD and any place where national statistical institutes come together, it is my impression that they're all eager to use this methodology, that they are often challenged by having the right people on their teams, and that they really need sort of on-the-job training, where they can use the people they have, skill them up, and add the missing pieces to their already existing workforce. It's too hard for them to compete with outside companies, for example, for people with those skills.
Excellent. We have other questions. Hello, there are, let me tell you, suspicious absence in this survey, like China. Are there alternative sources available for these countries in which Facebook could collect enough data in order to provide a more complete global picture for this COVID-19 study?
Yeah, so China is absent because Facebook is not allowed to operate in China, right? So they have their own social media platforms, and so we can and are not allowed to work with them. Same is true for Iran. There's, not because of Iran, but because of the political situation in the US, this is a country for which we cannot collect and report data. But I think this relates back to the earlier question on sort of national statistical institutes and how to think about this. With many of these alternative data sources or alternative ways to collect data, I'm of the opinion that some data is better than no data, and the perfect can be enemy of the good. If we keep trying to find sort of a solution that really works everywhere, we might not get anywhere in time. And so, I think to answer your question, Danielle, I think that, it would require a collaboration with similar widely operating companies in such countries. But I don't have the network to do that, and it looks like they have other policies anyway in place to combat the virus, at least in China.
Okay, other question. You have information about regional behavior of COVID in Mexico. In particular, you have information about regional behavior of the pandemic. That is to say, a description about COVID by state. Have you done any comparison between your data and the official statistics? Do you plan to create regional teams to have this type of comparisons analysis?
So I would love for you to do this analysis. I have not done it. We are so busy just keeping the operations alive that it would be really helpful to have local experts who know the country level data, or know the area, know what makes sense, would spot an oddity in the data, take the data, analyze it, compare it to the official statistics data, and see, do we see, for example, in the mask wearing, a change in policies, reflected in people's behavior or social distancing or what have you. That would be terrific. And that was part of the reason I thought to bring this set of data to you, to show you the possibility so that you can hopefully help us extract the value.
Excellent. Other question, with the data you have, is the forced lockdown better to contain the spread of the virus, or does it have marginal effect on the behavior of the pandemic? For example, did you find a significant difference between the spread of COVID-19 between Europe versus America or Sweden, which had a voluntarily lockdown?
So these analyses are being done right now. We're using a database coming out of Oxford where all the policies for the different countries are collected, and ideally we need them by region. In federal countries like Germany, the policies were quite different in the different states. And that analysis is underway. I can't say if it is visible in this data yet. I have seen other data from Germany where the indication is that it might be. The problem is to really have a causal analysis, you need to make a lot of assumptions. And you know, like any causal analysis situation, you know, well, a real life situation here, what people are doing is that they're doing a lot of measures at once, right? So knowing what the effect of one individual measure is always pretty hard. In Germany, we have seen that the anticipation of the lockdown already changed behavior quite a bit in the early wave. And so, you know, you don't see in the data necessarily the effect of the lockdown, but if you look at the behavioral, these yeah, I guess the behavioral data from the Google mobility maps, it's visible that this already happened a little bit prior, you know, in anticipation of this lockdown coming into place.
Excellent, thank you very much. Are the sampling mechanisms and methods for weight calculation public?
Yeah, so there is a paper that Facebook published on the weighting, the sampling and weighting scheme. And they describe the methodology they use. What they are not describing is in detail exactly which variables go in there and what the categories are for each of these variables. And that is to protect people's privacy. We wanted to make sure that there's really no way that one could reverse engineer any characteristics about the people out of these weights.
Other question, you talk about mental health. Which have been the most striking findings about it? Which type of public policy is needed?
That's a tough question. I need you to look a little bit closer at the work that's coming out of Johns Hopkins Group for public health, led by Elizabeth Stewart, my colleague. She's focused on the mental health aspects. One interesting thing that we saw, not necessarily from these data, but also others, is that there's clearly an issue for people living alone. That, you know, I mean, a lot of attention has been paid to people with children that are locked down and, you know, have to childcare stress on top of work stress and whatnot. And a little bit overlooked were the people that live alone, and that's certainly, I think, in the second wave a point for attention, because there too we do see the strong effect on their mental health reports, and it makes sense if you think about it, right? That might very much increase the sense of isolation, and even if you have fights with your roommates or housemates, a fight might still feel more like a human interaction than only being on screen with everybody. But I'm not a mental health expert, so I would need you to defer to those.
Other question, a comment is that maybe the survey should be available to everybody, not only at a random way. What do you think?
So this is super interesting. There have been actually a lot of data collections worldwide that were available to everybody. So if you look at MIT or Stanford, or, you know, here in Germany, the WZB in Berlin, you know, they all put out surveys very early on in the pandemic, and basically anyone could go to the platform and provide their information, and could do so repeatedly, because it basically was an open thing and people would be able to enter. And I think that I'm worried about analyzing those data, because then we have no idea of who it is that participated and how often an individual person would answer these survey questions. So I think that this random sample, you know, while it's not from a fully complete population frame, at least assures some reliability and validity of the data. Well, I guess in this case, more reliability than we would have with these voluntary surveys.
Excellent, thank you very much. What are the institutional conditions that are required for any country to effectively exploit the use of data science? What is the relevance of having an independent statistic bureau office?
So this is interesting, because, you know, there's a lot of movement on what's called citizen science, right? Everyone access to data, and and using that more. And close colleagues of mine, they sort of say, well, do we really still need statistical offices and the like? I do think that they provide tremendous value with their fine-tuned sense of looking at data quality. And so there will always be a role for benchmarking data, for, being clearinghouses, if you will. But I do think that it is necessary to, open up a bit and have more collaboration between the National Statistical Institutes and other, either individuals or research institutes that use data or data science techniques, and sort of explore pilot projects, see if they work, to have a signal on what's going on in the population, even outside these extreme situations as we have right now. And then once it's feasible, they can take that in-house, and do more with it. But I do think they have an important role. Also, like a good role model, I think, is Statistic Netherlands, who has really taken sort of a newsroom approach. They just want to make sure they are front and center in the conversation between the public and data about the country. And so they put out interesting statistics every day. They put out explanation about these statistics every day. And so I think we can, we can play a big role there in translating data to the public.
Okay. But other question, very interesting to explore opportunities, for example, or UN statistical community. How we can use this data?
I'm not sure which data you mean in this. Let me see if I can.
For example, UNICE or UNIP, you explain about other organizations that use the data that you make.
Oh, for this particular symptom survey, any government organization or academic researcher can have access to the data. So there's nothing. Well, yeah, I guess that is, and they're using them all very differently. So it's hard for me to tell how that is done worldwide.
There is other opinion. It seems the rate of mask wearing for Mexico and the States is overestimated. What do you think?
So this is great. I was hoping that we launch into this discussion. Is it overstated? That's a very, I'm asking you. So if you tell me this is not what matches what you see on the streets, then this is an important piece of information for me. If you have ideas on how to find validation data, that would be terrific. We have heard, or people ask us, if we assume that there's a social desirability bias, like any survey and self-report might suffer from. And that could, of course, be the case here too, that people say, sure, I wear the mask, when they indeed do not. So I'm curious to hear that. Of course, we should jointly look at the data and see at the exact wording. I think what I showed you were the graphs of that combined the categories mask wearing most of the time and all of the time. So if you look at all of the time, that of course would be a lower threshold. But yeah, if you have ideas on other sources, even small scale ways of data collection like we saw in the Netherlands to validate these data, I would love that.
Excellent. Other question. Once the team have developed this model and tested usefulness, always bearing in mind that it has the self-report bias, it is possible to use it to understand other problems. Some advances related to the study of mental health you have already shared. Are you considering addressing issues associated with unemployment and other important consequences of the pandemic?
Yeah, so Sergio, this is a good point. So first of all, I want to make one more comment on the mask wearing, right? So even if the absolute rate of mask wearing is overstated because of social desirability bias, then what we have to keep in mind is that what we're interested in is looking at the development over time, right? And so the social desirability bias this week might be just as biased as next week, and the development over time might still hold, you know. Of course, the counter argument is if the policy changes drastically, then maybe this assumption does not hold. So that would be an interesting way to look at this. The other element here to think of with respect to unemployment, we did ask about that, if people lost their job and things like that. But I haven't analyzed these data.
Thank you very much, Dr. Kreuter. Dr. Kreuter, can you give us a brief conclusion to close this panel? I have other question. Excuse me. Do you believe Facebook will be willing to work with the statistics community or similar survey-based approach, but in other areas that COVID?
Yes, I actually know for a fact that they do. They work with the World Bank already for a couple of years to use this kind of instrument to assess sort of participation of females in the, you know, as in entrepreneurial activities and things like that. And their group on using Facebook platform to create data for the social good certainly has an interest in that. So I think it's worthwhile reaching out to them if you have an idea and see if you can start talking.
Excellent. This is the last question. And Dr. Kreuter, can you give us a brief conclusion to close this panel?
Yes, so as I said, thank you all for participating and being interested. If you have thoughts on how to analyze the data, again, my warm welcome to do so. I can only encourage those on the call who feel like, you know, data scientists, this is other people but me, reach out and learn some of the skills. It's within reach. I've trained a lot of social scientists and economists and what have you to acquire these additional skills on, you know, moving big pipelines of data from one set to another, or to use machine learning techniques. It's, you know, it's not that hard to get there. So, you know, just think of yourself as a data scientist going forward, and then you acquire the skills on the way.
Well, thank you very much, Dr. Kreuter. We have run out of time. Nevertheless, we could continue this excellent discussion. I would like to thank Dr. Kreuter for her participation, as well as all the audience we have today in this event. Thank you very much.
Thank you.